Before we move on to the next section, I wanted to pause and share a quote. And just in case there are some folks who are listening who aren't looking at their screen, I will read this quote out loud. Mental health problems don't define who we are. They are something you experience. You walk in the rain, you feel the rain, but you are not the rain. And that is written by Matt Haig, a novelist. We're going to be talking about topics that are intense and may bring forward complicated emotions. So we wanted to pause and say, please take care of your own mental health and know that you are not alone on this journey. By working together, we can reduce stigma and help our children and families. As we talk about suicide prevention, please remember, while it may be uncomfortable to talk to someone at risk about suicide, you will not create greater risk by talking about it. And you may actually reduce risk by offering support and opening up a conversation about someone's feelings of hopelessness and or thoughts of suicide. Now we're going to go to the Mental Health Association in Delaware and to begin this discussion on our next topic, suicide prevention and crisis.
My name is Jennifer Smolowitz, and I'm the Director of Suicide Prevention at the Mental Health Association. And I'm going to talk to you today about prevention and early intervention and how both are possible when we talk openly about suicide. Often there may be situations where that may seem helpless or overwhelming, and you may not know where to turn. We want you to know that there is a community available to help educators navigate these tough topics, and you don't have to go at it alone. There are prevention measures on the front end, and we're going to talk more about those now. For an example, Nemours Children's Health provides suicide screening during medical and behavioral health appointments for youth ages 12 and older. We also have comprehensive evidence-based trainings that we can bring into the schools, such as the Lifelines curriculum, which is a whole school setting. We can do in-class settings with the students. There's also a parent component, so that the parents are learning what the students are learning and can have open conversations. And there's a staff and faculty component to that as well. So again, it's an all-inclusive, it's everybody is learning the same information so that they can have these open and honest conversations. There's also a QPR training, which is question, persuade, and refer, which multiple agencies offer. And that's something that we can do in an hour to 2 hour time. So you're a little bit more comfortable with knowing what to look for when it comes to suicide, what protective factors, what risk factors, how to help somebody in need. And that can be used for all ages, whether it's working with a student, a colleague, a parent, a family member who you're coming in contact with. That is something that we can bring to help on the school setting as well. We offer the ASSIST workshop, which is Applied Suicide Intervention Skills Training. This is a 2-day, full-day workshop that focuses on how to do a verbal intervention. If you see a friend or you're catching up with a family member, you're worried about a colleague, even a student, you're worried about somebody, how do we keep them safe? How do we keep them safe for now? Well, we can connect them to those additional resources that we've talked about that can keep them safe for a longer period of time. Another training that is offered is the mental health first aid training, and this could be offered for adults who work with adults or also adults who work with youth. So there are different components there. And that's really an introduction to what various mental illnesses, mental health concerns look like. It does talk about suicide prevention and awareness as well. And it's really important to know what some of the risk factors and protective factors are. We know that the more connections a student has or a person has to other loved ones can be really helpful in preventing suicides. Knowing that they have a trusted adult to talk to. If they don't have that trusted adult at home, knowing that they have that trusted adult at school, whether it's a coach or a teacher, whoever that may be. Also, limiting access to lethal means can be really helpful in preventing suicides. Problem solving, coping skills, those are all things we look for as protective factors as well. And when we look at some of the risk factors, being aware of some of the changes that the person may be experiencing, changes in their personality, changes in their behaviors. If they're usually happy and engaged and all of a sudden they're a little bit more sad, isolated, and withdrawn, we want to worry about them. But we also want to worry about those who go from being withdrawn to all of a sudden they're getting involved, they're seeming more social, and they're seeming like things are kind of figured out. That doesn't always mean that what they're going through has gotten better. Sometimes it means that the end to the pain they're experiencing is near. They have made their decision to die by suicide. So we want to be aware of all changes that you may see. If somebody is acting more aggressive, that could be a risk factor to look out for. Changes in their appearance, paying attention to their assignments, the things that they're writing about, the things that they're posting on social media. Even for the younger kids, some of the pictures that they're drawing can be really telling of some of the thoughts that they may be having. And a lot of the trainings that I mentioned do go further into what these risk factors are. And if you do identify somebody showing some of these risk factors, how we can get them connected to help and resources. So I'm now going to turn it back to Malia Boone to talk about crisis intervention.
Thank you, Jennifer. So crisis intervention. So once you've identified that risk factors are present and there's some concern for a child that you may be working with, accessing crisis intervention services could be the next step to making sure that youth is safe. Crisis intervention is a service provided for children and families when they need extra support or assistance navigating what to do next to support their child. I think it's important that families know that there doesn't have to be an imminent crisis situation occurring in order to access the crisis service through Delaware Guidance, the mobile response program. This program does provide a risk assessment so that we can fully understand the concerns related to what the child and the family have been going through. Families can also access a risk assessment at a psychiatric inpatient facility. Sometimes that can be the best course of action when a child wants to access inpatient psychiatric services immediately to keep their child safe. And then the resource through the mobile response crisis service is when we can come to you and we can help figure out what is happening, what is the best course of action, and how to best support your child. So the MRSS program provides that risk assessment, helps the family decide what steps to take next. We create a safety plan, and we also are providing additional support to make sure that we're on the right track towards stabilization. So that extra support can last for up to 30 days after that case opens, once we've completed the risk assessment. And our goal is really, we want to assist families in connecting to those resources in the community that are available for the long term to make sure that that continued stabilization and safety is occurring, and continuing to work on strategies as well to help the child feel better. So having access to a crisis clinician who's going to, right from the beginning, start working on some of those strategies that help make things a little bit better as you're also trying to access the other resources that are available to you in the community for more long-term stabilization. When schools are involved in navigating a crisis, it's really important that there is clear communication with families about the concerns they're having for their child. And we want to utilize a trauma-informed approach to both understanding and explaining the behavior that the child is displaying. It's also useful for the school supports to give families information about what to expect and how to access crisis resources. When calling into the crisis hotline to access the resource, you will be asked to provide demographic information and information related to the crisis the child is experiencing. So then the crisis program can dispatch a mobile clinician. So they have all the information they need and they can get out to you within a pretty short period of time. This is usually occurring in about an hour of the call requesting the support, if that request is for an immediate response. The crisis service is a voluntary service and families consent to the service. So that's also important to understand in terms of accessing the service. We want the family to be a part of that process. They're integral to understanding and supporting their child. So we want to make sure they're agreeable to receiving the support and they can be involved in this process as well. So next we're going to turn to Kat Albrecht with the American Foundation for Suicide Prevention.
Thank you, Malia. My name is Kat Albrecht. I'm the Maryland and Delaware Area Director of the American Foundation for Suicide Prevention. So what is going to happen when a school experiences the suicide loss, and how can community resources help support the school staff, and families. The American Foundation for Suicide Prevention, in partnership with the Suicide Prevention Resource Center and the Education Development Center, developed an after a suicide toolkit for schools. The toolkit provides information on how best to communicate and support the school community and manage the crisis response. Also found in the toolkit is information on helping students cope, communicating with parents and media, working with community, and engaging external resources for support. The toolkit includes topics like social media, memorials, and contagion. We added additional information to help decide how to appropriately remember and honor a student without contributing to additional emotional trauma or suicide risk. Schools should create an individualized crisis plan. No school is like another environment or another school. So really make sure this fits your school and your community. And organizations like everyone listed here and talking to you today can be a part of this. They can have additional resources that are not available to the school yet. They can identify gaps, strengths, and how to improve this plan. The After Suicide Toolkit is a great start to create this post-vention, so after suicide plan, but also inform your prevention plan for the school system and its families. However, I urge you to also include resources that are available in your community that's surrounding the school. Create a list of local resources, and that list should be updated annually because organizations, the person in charge might change this. All administrative staff should be aware of those resources in the case that the person in charge is not available when a suicide attempt or a suicide loss occurs. Talking about suicide does not lead to more suicides. Addressing what happened can start a conversation to break down barriers and foster plans for the future. Please know that using the word suicide does not plant the idea in somebody's head. Contagion is relatively rare. However, adolescents and teenagers appear to be more susceptible to imitative suicide than adults, largely because they may identify more readily with the behavior and qualities of their peers. Also, please remember that their brains are often not developed. We don't develop our brains till we're at the age of 25. So their thinking is very different and very impulsive. If there appears to be contagion, schools should consider taking additional steps beyond the basic crisis response outlined in the toolkit to avoid suicidal behavior and further deaths. It is advisable for schools to increase efforts to identify other students who may be at a heightened risk to suicide and actively collaborate with community partners in a coordinated suicide prevention effort. This really needs to be fluent and possibly bring in outside experts. Of special concern are those students who have a history of suicide attempt, students who have a history of depression, trauma, or loss, students who are dealing with stressful life events, such as a divorce in the family, or students who had a death in the family recently, or maybe something that they're still struggling with. Students and faculty who received a phone call, text, or other communication from the deceased foretelling their suicide and possibly feel guilty about having missed warning signs or not being there for their friend or their student. Any students who had a last very negative interaction with the deceased, or students who may have fought with or bullied the deceased. So any of these students should be talked to. They should be provided additional resources, and you might want to keep an eye on them for a longer period of time. To avoid a suicide cluster, please notify surrounding schools, community partners working with your school, and also local mental health organizations that can support your students and staff outside of the school system. This way, other schools and the community can keep an eye on our youth and keep them safe.